Hello, I am so glad you're here. In this masterclass, I'm going to give you the answers to putting an end to painful sex for good. And the best part is you can start at home today. For those of you that don't know me, my name is Dr. Christy Thozer. I'm a menopause and sexual health specialist PA and clinician at Corla Health. It's my pleasure to welcome you to today's masterclass. I want to start with this because it is so important and I cannot emphasize it enough. If you are suffering from painful sex, vaginal dryness, irritation, or atrophy, you are not alone and there are proven effective solutions. I want to tell you a bit of a story. When I first started working in OBGYN, I thought my days would be filled mostly focused on pregnancy, birth control, pap smears, routine visits like that. And there was plenty of that, of course, but over and over again, I was meeting people who had been suffering in silence for years with dryness, burning, and pain. And before they came into my office, they had never been offered help. I had patients who couldn't even sit comfortably or ride a bike. They dreaded intimacy because they're having so much pain, and they felt like they were losing a part of themselves. And that's not even to mention the frequent UTIs, which is another common occurrence with low estrogen and can open you up for other health risks. But with all of this, I was seeing patient after patient suffering, never having been told there were answers, and almost all of them just thought this was something they had to live with. So after hearing so many stories like this, it finally just pushed me over the edge. I couldn't sit quietly anymore. It was completely unacceptable that people were suffering like this when the solutions were out there, and even when they asked for help, they weren't being given the answers. For years, I had waited for people to find their way into my office so I could help them, but I finally realized that wasn't enough. I decided to speak up loudly to make sure this message reached people before they spent years in pain. I started working hard to get the word out. This is not normal. You do not just have to put up with it, and there are real, effective solutions that can bring you relief. I dove deep into sexual health and hormonal medicine. I earned my doctorate degree focusing on menopause symptoms and sexual health, and I spent years refining an approach that puts the patient at the center of everything, is evidence-based, and actually works. I got the word out on how to address the underlying cause, not just patch the symptoms, and I've seen person after person finally get the right support and resources and get relief from dryness and irritation, enjoy intimacy again, and just get back to feeling comfortable. I've heard so many people tell me that it feels like they got a part of their life back they didn't think was possible. And this isn't a rare story. It's what happens when you finally get the right resources, the right support, and the right information. So before we go any further, I want you to hear me. You do not have to live with pain and discomfort. There are solutions that work, that solve the problem at the source and provide lasting results. In my program, which I'll tell you more about later, I provide people with the solutions and treatments, and I walk them through everything step by step. But right now, I'm going to share the three most important things you can start doing at home this week to start the process and begin feeling more comfortable. So, to start with, I know how important it is to have a good understanding of what's going on with your own body. When you finally understand why something is happening, you can take back control of it. There are significant physical changes happening, and once you know what they are, you can start reversing them. And knowing what's going on is the first step. It puts the power back in your hands. So, I want to show you a diagram and help explain what's actually going on. Your vaginal and vulvar tissue is lined with something called epithelial cells. Let's just call them skin cells. Estrogen keeps those cells plump, elastic, and full of natural moisture. It's naturally well lubricated and it's resilient. It's able to move, stretch, and heal easily. When estrogen levels drop in perimenopause and menopause, whether that's natural, surgically induced, medically induced, those cells shrink. The lining becomes thinner, it loses hydration, and worst of all, it becomes more vulnerable to tiny micro tears. These are tiny little tears in the skin that aren't usually visible to you, but you sure do feel them. It's that raw, sore feeling. That tissue can become constantly inflamed, trying to heal, so anything that touches it can feel uncomfortable, let alone attempting intimacy. And these changes impact other parts of your physical health as well. One of the lesser known side effects of low estrogen in this area is the increased risk for recurrent UTIs. When that tissue thins and dries, it loses some of its natural defense. That means bacteria can travel more easily into the urethra, and many people end up with frequent UTIs. Those UTIs can lead to urgent care visits, rounds of antibiotics, and opening yourself up for other health risks. The good news is you can strengthen and protect this tissue again, even after estrogen levels drop, and I'm going to show you how. So let's walk you through the 3 steps you can take at home this week to help this tissue out and get some relief. One of the best at-home methods to support tissue health and improve comfort is to use a vaginal moisturizer. We talked about those thin, dry, sore skin cells. Moisturizers work by soaking into them and helping them hold water again. Over time, we see that this rehydrates the tissue, brings back some elasticity, and makes the whole area more resilient. If you decide to try one, read the label and look for these 3 things. You want something that's fragrance-free because perfumes can irritate that delicate tissue, pH balance because your vaginal pH should be slightly acidic to keep good bacteria happy and bad bacteria in check, and hyaluronic acid based, which can restore deep hydration right where you need it. Here's a routine I give my patients. Apply about a dime-sized amount internally and externally, but that will depend on the product you choose. And this is really important to remember. Some people have a misconception that this is just applied before intimacy, but actually you would ideally apply it on days you're not planning to be intimate, or at least 2 hours before so the tissue has time to fully absorb it. And it's really important to apply vaginal moisturizer regularly throughout the week. I recommend 2 to 3 times a week to start with for at least 2 months. Then you can experiment with tapering this down until it's just once a week. But this will be different for everyone and will just depend on what your own body needs. But remember, the most important thing is to be consistent. You're likely to notice improvement after just a couple of applications, but real results happen over weeks of regular use and being consistent going forward from there. So that's step 1 to start healing and protecting the tissue. Next, let's talk about what to use during intimacy so you're comfortable in the moment. So if moisturizer is about rebuilding comfort over time, lubricant is about protecting comfort in the moment. And here's another misunderstanding I want to set straight. Not all lubricants are created equal. Some will feel great for a few minutes, but they dry sticky. Others last longer, but can cause irritation or even damage certain toys and condoms. Choosing the right one for your body and your situation is huge because the wrong lube can actually make dryness worse. So let's walk through the different types of lubes and which might be best for your situation. So in terms of feel, water-based is going to feel more natural, whereas a silicone-based, oil-based, or hybrid, which is a mix between silicone and water, will feel more slick, less of that just natural watery feel. With toys and condoms, water-based is really your best bet. Definitely not oil-based. Silicone and hybrid are a sometimes sort of thing, so just check labels. And then in terms of reapplication, silicone, oil-based, and hybrid are going to stick around longer, so you are less likely to need to reapply than if you use a water-based lube. If you have sensitive skin or you're worried about interactions, honestly, water-based is the safest route to go. But like I said, it just depends on you, your situation, your preferences, and just choosing the right lube for the situation. Some ingredients to avoid. Watch out for warming or cooling agents, fragrances, as these can all cause more irritation. So moisturizer rebuilds comfort, lube protects it in the moment. Now let's talk about one everyday habit that can undo all your progress if you're not careful. This one surprises some people, but you can really aggravate dryness and irritation by the way you're showering. The skin on your vulva is not like the skin on your arm or your leg. It's thinner, more delicate, and it's designed to stay at a slightly acidic pH to protect against bacteria and infections. When you use scented soaps, wipes, or washes, they can strip away your natural oils and disrupt that pH, leaving you dry, itchy, or more prone to irritation. So really, the healthiest option is warm water only. You do not need soaps, anything with fragrances, no harsh cleansers. One of the fastest ways to feel more comfortable is to just stop using the things that irritate the tissue. So here's your 3-step comfort plan. Rebuild your tissue health with a moisturizer, protect it in the moment with the right lubricant, and preserve your progress with vulva-friendly care. These 3 steps can do a lot to help ease your way and help you feel more comfortable. But here's the thing, the strategies you learned today mostly just work to address the symptoms. Kind of like a Band-Aid, they help, but they don't fix the source of the problem. So we talked about it earlier. Without estrogen, the lining of the vagina becomes thinner, less flexible, and more susceptible to injury. It has less blood flow, which, by the way, is essential for arousal. And to top it off, you have more susceptibility to frequent UTIs. We can absolutely use the methods we discussed to really help protect the tissue, but those steps don't necessarily do anything to change what's actually happening to those skin cells and to that delicate lining. And the worst part is, this is a progressive syndrome, meaning it doesn't get better on its own. Unless you intervene, it just keeps getting worse. But we have treatments to stop and even reverse these changes. We can address the problem at its source and fix the cause. And that's exactly what my program is designed to do. We can restore estrogen directly to the vaginal and vulvar tissue safely and effectively to bring back thickness, moisture, elasticity, and resilience. I also want to point out that this is safe for breast cancer survivors and patients. It doesn't carry the same risks as typical hormone replacement therapy because it targets the tissue directly without impacting the rest of your body the same way systemic hormones do. So if you have a history of breast cancer and thought something like this wasn't an option for you, I'm here to tell you it is. And if you're already on standard HRT, this works beautifully alongside it, so you're treating the whole picture. So in my program, we take people from pain, dryness, irritation, and thinning to comfort and restoration of that tissue. And when you start with us, there are two outcomes. You have your onboarding, you get your care plan, and at that point, you're either satisfied or you get your money back. There is no risk to start, and I can offer that promise to you because the treatments work. They're backed by science, my expertise, and years of clinical experience seeing the transformations my patients have. You need a clinician who believes you when you explain what's going on, and then you need them to have the expertise to solve the problems you're having. But we want to give you so much more than that. What we offer is full service, unlimited support. No quick appointments and then one size fits all solutions. With us, you get a deep dive onboarding session and a tailored care plan. This is an in-depth session where we really dive into the full picture for you, and you walk away with a personalized care plan with your prescriptions tailored to your history, your body, and your needs. And we don't stop there because you'll have full support going forward. Message me anytime, whether you have a quick question, need reassurance, or you just want to check in on how things are going. You'll have me in your corner when you need me. We'll have regular follow-up appointments, so we have a scheduled time to adjust where we need to. You'll get access to our trusted referral network, and annual members get free access to our monthly expert workshops. We cover topics like hot flashes, libido, pelvic floor health, and more. You'll hear directly from experts and get full package menopause support. So now you see why we're confident in our guarantee. I'm so passionate about this because I've seen the difference it makes in people's lives when they finally get the treatments and the support they need, and I want that to be you. If anything we've talked about today has resonated personally, then this program was designed for you. You'll get that entire care package for only $69 a month. Or if you pay annually, you'll get 40% off and get a whole year of unlimited, personalized menopause healthcare from an expert for under $500. If you're interested in joining, just click the button below to get started. But I have to tell you, because this is such a personalized program and I want to give every member the dedicated attention they deserve, I can only take on a limited number of new patients each month. Once these spots are filled, I'll need to close enrollment until I can take more on. So if this resonates with you, I encourage you to claim your spot now while I still have openings. I want you to finally get the care you deserve. If you're ready to solve pain, discomfort, and dryness, and to have a specialist in your corner every step of the way, click on the link below and choose the membership that's right for you. If that's not something you're ready to do yet, no worries. I've got more free resources linked below to help you in the meantime. Either way, let's get you feeling better.